Hi, welcome to MANTHRA Academy, online crash course for nurses. Medical Surgical Nursing, continuation of oncology disorders. Part 2. Today we are going to discuss regarding bladder cancer, breast cancer and cervical cancer.
If you didn't subscribe Nursing Mantra YouTube channel until now, please subscribe now and enable the bell icon to get the updated notifications.
First we will go through bladder cancer. Bladder cancer is the papillomatous growth in the bladder urothelium that undergo malignant changes. Common metastasis sites include liver, bones and lung. The causes for bladder cancer are cigarette smoking, cancer arising from prostate, colon and rectum, pelvic radiation therapy and all cause the bladder cancer. Assessment means painless hematuria will be there, urinary frequency, urgency, and through the diagnostic evaluation like cystoscopy, excretory urography, biopsy also confirm the diagnosis. What is the management for a bladder cancer means radiation therapy of the tumor may be performed pre-operatively to reduce the extension of the neoplasm. Radiation therapy we can provide to reduce the size of the tumor. Then alkylating chemotherapeutic agent also instilled into the bladder. Systematic chemotherapy is also used to treat inoperable tumors with distant metastasis. Surgical management include transurethral resection of a bladder tumor and fulguración, passing of electrical current to destroy the tissues. Partial cystectomy may be performed. Cystectomy means the removal of the bladder, okay? Cystectomy and urinary diversion may be performed for extensive tumors. And what is the nursing intervention for bladder cancer? Pre-operatively, the nurse should obtain informed consent, maintain the patient NPO status, encourage discussion of feelings, include the effect on sexual activities and all. Then post-operative interventions means we have to monitor the vital signs, monitor for any post-operative complications such as shock or hemorrhage, any thrombophlebitis and all, the nurse should monitor. Monitor continuous urine outflow like 30 to 60 ml per hour. Monitor for bladder distension after a partial cystectomy. This is the nursing intervention.
If you wish to know more details about this book, feel free to contact me in WhatsApp. WhatsApp link I mentioned in description box.
Next cancer is breast cancer. That is a metastasis of the breast cancer that occur mainly by lymphatic spread. And common sites of metastasis include lungs, liver, brain and bones. The causes for breast cancers are genetic alteration are associated with the development of breast cancer formation and unknown origin. Prevention is monthly. We have to do the breast self-examination. Precipitating factors: family history, early menarche and late menopause, previous cancer of the breast, uterus or ovaries, nullipara women and obesity, high dose radiation exposure to the chest, high fat diet. These are the risk factors or precipitating factors for breast cancer. Then we have the signs and symptoms means lesions are non-tender than painful. Then mass felt in the upper outer quadrant of the breast, discharge from the breast, lymph edema of the affected breast, then a skin edema of orange skin edema or like pure orange skin like that. That will be the signs and symptoms for breast cancer. In a diagnostic evaluation, early detection can be done by monthly breast self-examination. Diagnosis is made by breast biopsy and mammography can be also used as a diagnostic tool. The management means we have a chemotherapy, radiation therapy, then a surgical intervention include a lumpectomy, simple radical mastectomy, or a modified mastectomy means the removal of the breast, okay? Modified radical mastectomy, axillary lymph node resection, total mastectomy, radial mastectomy, like that. That is a surgical management also there. Then prevention means advise the client to reduce the amount of fat in the diet. Early detection include BSc once a month. Yearly breast exam by a healthcare provider. Baseline mammogram between the ages 35 to 39. Yearly mammogram after the age of 40 years. These are the preventive measures. So this is breast self-examination, mammography and all. So assessment, there will be mass felt during the breast self-examination, usually felt in the upper outer quadrant or beneath the nipple. A fixed, irregular, non-capsulated mass will be there. Painless mass except in late stages. Later stages it will be painful, but initially it will be painless. Sometimes the nipple is retracted or elevation of the nipple also can be. Then asymmetry with the affected breast being higher. Then a bloody or a clear nipple discharge, skin dimpling, retraction or ulceration, skin edema, lymphedema of the affected arm. Then all these are the symptoms of breast cancer. You can see here a thickening of lump in the breast, constant pain, or this nipple becoming a regular shape and all, swelling in the collarbone or armpit. Skin changes like dimpling and all. Unusual discharge from one or both nipples. A change in the shape or size in one or both breast. So management, chemotherapy, radiation therapy, hormonal manipulation, the medications such as tamoxifen for estrogen receptor positive tumors and all. And surgical intervention, surgical breast procedures with posterior breast reconstruction, oophorectomy for estrogen receptor positive tumors, ablative therapy with adrenalectomy. So nursing management for this breast cancer is pre-operative intervention, like we have to explain to the patient about breast cancer treatment options and all. Then reduce the fear and anxiety by providing psychological support, obtain an informed consent. Then post-operative intervention means we have to monitor the vital signs and provide a semi-Paulus position. Encourage deep breathing and coughing. Then assess the operative site for any swelling or discharge. Then monitor fluid and electrolyte balance. And especially the arm area where the lumpectomy has done, that area has to elevate, the arm has to elevate the heart levels to reduce the swelling and all. This is related to the breast cancer. Now we are going to discuss regarding cervical cancer. Cervical cancer metastasis is usually to pelvis area and mainly by lymphatic spread. Then risk factors are human papilloma virus and cigarette smoking are the predisposing factors. Assessment means there will be hematuria, foul smelling vaginal discharge, dysuria, weight loss. Screening is usually done by pap smear. So that is cervical cancer. This is the cancer you can see here. So the precipitating factors, low socioeconomic status groups, early first marriage, early and frequent intercourse, multiple sex partners, high parity, poor hygiene and all. So you can see the stages of cervical cancer here. Then the early stage and the late stage and stage 2 and how it is affecting the cancer. So early detection by the practice of good perineal needs must be emphasized. Perineal care should be good practice should be there. Avoid sex in an early age. Avoid numerous partners and practice the use of condom. Then cancer warning signs are abnormal vaginal bleeding and spotting after having sex. Then if there is any abnormal vaginal bleeding or spotting after having sex, that is a cancer warning sign. Then early detection include pap smear for women over age 18. So like this we are taking the pap smear, swabbing that area by using the proctoscope, visualizing the cervix area and taking the pap smear. Then another thing is the biopsy, cervical biopsy. A small tissue sample are taken from the cervix and examined for disease or other problems. Then signs and symptoms, there will be painless vaginal bleeding post-menstrually and post-coitally also painless vaginal bleeding will be there. Foul smelling will be there, vaginal discharges. Then pelvic, lower back, leg or groin pain, anorexia and weight loss, leakage of urine and feces from the vagina, dysuria, hematuria, cytological changes on pap test and all. Then interventions for this cervical cancer are chemotherapy, radiation therapy, cryosurgery. Cryosurgery means it is a freezing of the tissue by using a probe with a subsequent necrosis and slough that area. Then surgical interventions include conization, hysterectomy and pelvic excineration and all. We can do as a surgical management. Nursing management, we have to monitor the vital signs and bowel sounds, instruct the patient to avoid strenuous activities, monitor for vaginal bleeding following hysterectomy, monitor for signs of complications and all. These are related to the cervical cancer. Post-operative care, estrogen replacement immediately post-op if the ovaries were removed. Now vaginal entry, douching or intercourse for 4 to 6 weeks. Avoid bending knees. This is related to the cervical cancer. I hope you understood regarding the various cancer types.
Nursing Manthra website provides you information about nursing news related to licensing procedures to different countries. Study materials for different exams like DHA, HAAD, MOH and other PROMETRIC exams. Various job informations in the medical field. Free PPT presentations and notes for the nursing students as well as the lectures. DATAFLOW and licensing verification services to all countries. Free crash course videos for different nursing exams in Nursing Manthra YouTube channel. Current news in the nursing field. I am inviting everyone to the Nursing Manthra family. Please subscribe and join Nursing Manthra to avail more updates. Thank you.